All right, welcome guys to the Immortal Cast. What is this, episode 5 or 6, something like that?
Episode 6.
Episode 6, baby. Honored today to have awesome guest with us. We're going to talk about all things stem cells with the mastermind, the founder of Stem Cell International or Cell Rejuvenation International, Rustin Savarese. Welcome on, brother.
Matt, how are you? Good to see you again. Just down here a couple of weeks ago, so.
Yeah. Well, Coleman, we're down there getting I got my second round. Coleman got his third round down in Colombia. The coolest thing, man, we'll jump right into it, was just the holisticness, if that's a word, the holistic experience. I've learned so much about my health, so much about my body. You guys didn't just bring me down and just stick some stem cells in me and tell me to, good luck or whatever, right? I did a lot of prep work to even get down there before I even got the stem cells. So let's jump into it. Russ, talk about that, man. Tell us all about the process you guys put us through.
Yeah, that's, it's been a long journey myself to get to that point. And I've looked at some of the big dogs that are out there. Some of these places are doing, maybe 20 to 30 patients per weekend. And it's really hard to do what you just said. If you're trying to see that many people every single weekend. So we're more 3 to 5 people per weekend, but it enables us to give that individual type of service. And things like your blood work, the markers in your blood, sectioning off when you get the stem cell. These are things that bigger places don't do. It's just kind of hard to do it because you have to individualize the program. But for me, on my own journey back to health, I went to some of these places, kind of how I learned it. And looking at the protocols, these things are super important. So you'll get results without doing that. But real benefits are following these type of markers in your blood. Everybody that we're talking to is mostly athletes. So everybody's on some form of testosterone, TRT treatment. Everybody's taking peptides, they're taking supplements. And if you don't take this stuff into factor, you're not going to get the best results.
Yeah, what you mentioned your own journey on to health there, right? I remember you told me you had some mold toxicity, which had played a huge role in you learning about your health. And I don't know, just talk about that, man. Good, how did all this start? How did this come about? What were you doing before stem cells? Let's go into the history here a little bit.
Yeah, so I've been in medical for about the past 20 years, running CE courses in the United States. We have a couple of groups of doctors, one with 400, other 20,000. I came down actually to Colombia to open up new phone rooms. I had some in the Dominican Republic. We were opening more here for our medical clinics in the U.S. I had a problem with my neck. Everybody was telling me I needed to have either fusion surgery or disc replacement. And everybody that I talked to that either went with one of those two options, nobody had anything positive to say about it. So I was looking for an alternative, and I was here in Colombia where some of the best stem cell in the world is. And I started looking into it. I went to the bigger companies here, felt like it was more of a sales process. Went to some smaller guys, found out they were buying stem cell frozen third-party individuals. So it really took me down this rabbit hole. I finally decided on a doctor and a laboratory that produced a really high-quality stem cell. I did the injections in my neck. And literally within 3 months, a problem I've been dealing with for 15 years was completely gone. The numbness in my hands, tossing and turning all night. My arms were burning. Fire that I would get, the pain in my neck going into my shoulder blade, completely gone. So I took this as a sign, hey, let me open a small clinic down here. I have so many friends that are athletes, so many friends that are doctors. We help these guys with, these type of sports-related type injuries. During that period of time, I moved into this big house in Colombia and was living in the tree down here. 3 months afterwards, started feeling sick. 8 months after that, I was almost completely incapacitated. I couldn't work, brain fog, completely exhausted, lost like 10 or 15 pounds. Nobody could tell me what was going on. Mm. End result of it was I found out I had mold toxicity, and it was killing me. It literally killed me to the point where I was making final arrangements for myself. During this same stretch of time, and this is where God's faith comes into play. 2 of my friends that I went to high school with, they died. 2 of my friends' fathers who were healthy went into the doctor, said, hey, you have stage 4 cancer, and they died. So during this period of time, I was sure I was next. I was listening to these stories, and all the cases had one thing in common. If they were just doing regular blood checks, if they were just monitoring their health, and somebody was doing blood checks every year even, and comparing them to the other ones, all this stuff was preventable through diet, through nutrition. Nobody had to die. So this kind of became a new path for me at that point, where it wasn't just about healing, joints and sports related injuries. It was more about overall health.
We were just talking about that last week, right, Roddy? We were talking about, dealing with death and different people. Roddy's mother passed away recently. And, that I think that it tends to really kick your ass into high gear, right? And you're like, okay, I need to take care of myself. It reminds you of the brevity of life and what we're actually dealing with here. And it's not going to be, nobody walks out of here alive, right? Yeah. So let's make the most of it.
What but I think, like, to that point too, Matt, and what Rustin's saying too is, like, a lot of people are afraid they don't want to know. You know what I mean? Like, I have a friend that had testicular cancer when he was younger, like in his 20s, and I met with him like while I was back in Ohio. We had a couple, went out or whatever, we're talking, and he told me the whole story about it. I never knew the whole full details of everything. And I'm like, so do you get checked out now? He's like, no. And he said that. I'm like, why do you say it like that? He goes, I don't want to know. I don't want to know.
Yeah.
And I think it's scary, and especially with what Matt and I had talked about, because a lot of people are on the fence with a lot of these, methods they have of curing cancer or whatever your disease might be. It almost seems like they just want to keep you on the hook for as long as they can and just, ping you. So, like, what would your, like, Rustin, what is your, how do you go about kind of telling somebody, hey, listen, man, there's nothing to be afraid of. You got to get ahead of it.
That question's in twofold. So a lot of the guys that I deal with, we're all alphas. And, if an alpha's arm isn't hanging off of him and he's bleeding to death, he doesn't go see a doctor.
Yeah.
I mean, we're all guilty of that. We're all guilty of people that we love. They get a little bit sick. We're pushing them to the doctor. We're trying to find out what's wrong with them. But when it happens to us, we'll just rub some dirt and walk it off. So I got to deal with it all the time. And I'm pretty sure I've lost out on some patients also because, having them do the preliminary work is just too much, for them to do. So the thing you'll find out about Colombia, the doctors here are different. The medical system here is different. It's rated higher than the United States and Canada. So when you deal with just an average doctor down here, and this took me by surprise, and this is something that all the clients say when they come down here, the amount of time the doctor spends with you, it's not like the United States where they're just trying to push 100 patients in 3 or 4 hours. I work with big medical groups. I know what they do. They're in and out. The nurses handle most of it. Doctors here will sit with you and talk to you as long as you possibly need. But also, their ideology is really different. If they find something wrong with you, they're not looking to give you a pill. They're looking to find out why that's wrong with you in the first place. So if your blood pressure is high, they're not going to say, okay, here's a blood pressure pill. They're going to try to find out, why is your blood pressure high in the first place? And that's something that blew me away with the doctors down here. And it seems that every client that we bring down, that's the first thing that they say. They're amazed at how the doctors treat you. And I've gone through extraordinary effort to find the best doctors that we can. A lot of our doctors are trained in Spain. Neck and spine surgeon that we have that worked on Matt. He's trained in South Korea. And if you don't know about South Korea has pretty much leading the way when it comes to stem cell and also leading the way when it comes to neck and spine surgery. So they're doing things there that aren't even out in the United States now, things that'll blow you away. So these are the doctors that we brought on staff. And even our sports medicine doctors are also, so we kind of over skill on every single position, as opposed to just having somebody jabbing a needle into you. So,
and I can attest to those doctors, sitting down with them myself and, working with the few different doctors there. I can attest to how personal they make it feel right away.
How, you had mentioned something too, Rustin, when you first started talking, you said that that Colombia had some of like the best stem cells. Like what's the difference between like Colombia's stem cells and everybody else's stem cells?
Yeah, it's a great question, and it's it's
And maybe even Russ, maybe not to interrupt, but maybe even maybe you take a step back and explain what a stem cell is, and then why Colombian stem cells are even better, right? Because I think a lot of people don't even understand what it is. They think it's PRP or that we have stem cells, exosomes, all these peptides. Like everybody gets confused here.
yeah. So let me explain the differences, and then from there I'll explain why it's different in Colombia than it is in the United States. So, and I have that a lot. I have people come down here and they'll say, "Oh, I've done stem cell before," and they'll give me the price that they paid for it. I'm like, "You didn't have stem cell. You either got ripped off or it wasn't stem cell that you had, because there's no way you could have had it done." And you're right. A lot of them, it's almost like PRP is on the spectrum, right? And we do a combination. We do a knee injury or shoulder injury and it's severe. We will do a combination of PRP with the stem cell, also exosome treatment. So depending on the severity of the rip, the tear, the area that it's in, kind of depends on the series, the protocol that we'll follow. As far as the difference is concerned, what we use here is we're using it from the umbilical mesenchymal stem cell. Just that in itself, getting it from the umbilical cord, there's so many rabbit holes I can go down. For example, we'll only use women that it's their first baby between the ages of 20 years old and 25 years old. And it's very important because the younger the donor is, the healthier that person is, the healthier their cells are. The less babies they have, the more damage that was done. So there's a whole rabbit hole behind that. So there's different qualities of umbilical cords also. And this becomes a big question too. Posted something just recently, and God, there's so much misinformation out there. Nobody is stealing this from the woman. The woman actually donates it. The women aren't making any money off of this. They're part of the program. So in our case, we have contracts with fertility clinics all throughout Colombia. We know all the doctors. So when the doctor finds a good candidate, they put them into their program. The only benefit the woman has to being into our program is when she gets, we take that umbilical, which in 90% of the cases is just thrown out. We take it, we use it to make our stem cells, but we also make them for the baby, the mother, and the father. So we make it available, something that they normally wouldn't be able to afford. We also give them a higher quality of prenatal care that they might have not gotten if they weren't in the program. So from that umbilical cord is how we create the stem cell itself. And again, there's different qualities to that. So inside the cell itself, let's go back to the cleaning process. So this is one part that's different in the United States and Colombia. For everybody, I can talk about this forever, but I'll go simple.
Bore everybody. Yeah.
When you clean the actual umbilical cord, you create the cell itself, the mesenchymal stem cell. There's different ways of doing it. So the cheaper, easiest way is with a lot of chemicals and harsh ingredients. That's what's done in the United States. Here we do it by hand. It takes us 8 days to actually clean that cell. It's done by a polishing technique. It's done by shaking and all the stuff that goes on inside the laboratory. It's not done with chemicals. At the point when it actually becomes a cell, we send it off to secondary laboratories to certify it. So on our side of it, we do 98 different tests for cancer, HIV, COVID, any flaws in the DNA. And that's because it's regulated here in Colombia. It's not regulated in the United States. So there's no mandatory that they have to test those cells for those things. So now you don't know where the cell is coming from. You don't know who the donor is. You don't actually know how it's cleaned or prepared or what's inside the cell because there is no standard in the United States for it.
Huh.
The biggest factor is what's called a human growth factor. You are not allowed to use a human growth factor in the United States. So even when you have the cell and we take that individual cell and we grow it to 100 million, that's by using a human growth factor. You cannot do that in the United States. So in the synthetic process, from one cell in the United States, maybe you would get 14 million. But the activation ratio in that 14 million is going to be about 40%. Then you have markers like anti-inflammatory markers and recuperative markers. I go on and on. Your markers in the United States will be around 30, 40%. This is why most places in the United States did not present to you the lab reports. Mark can attest to this. When he gets his stem cell, we not only have our lab reports, we have third-party laboratory reports on those cells. So when we add the human growth factor, there's two parts of it here. if you're getting it from a third party, and this is very important, any facility that you decide to go with, if they don't own and have their own laboratory, that means they're getting it from a third party laboratory. So when they activate it, they're freezing it and using chemicals. Once it's frozen, you're killing the activation. In our case, in some of the bigger companies' cases, we activate it on site in our laboratory. So 3 days before Matt gets his stem cell, we actually start the activation process. So when we add the human growth factor, we can take that one cell, bring it up to 100 million now. And out of that 100 million, our activation ratio is 95 to 98%. Our markers in it, your anti-inflammatory, your recuperative markers are 99 to 100%. So I always tell people, I'll compare our stem cells to anybody else that's out there. I know what our laboratory goes through. And that's another thing with the bigger company. We are only capable of producing 500 million stem cells per week. If you're doing 30 patients per week, I don't know how they keep that quality that high. It becomes like a McDonald's at that point.
Yeah.
So the quality of the stem cell can significantly vary. So when people are looking for a cheap price, especially if you're calling Colombia, you will find the cheap price. Good luck.
But can I ask a question with regards to like the growing the stem cell? That's interesting. So you're taking like, and unless I'm completely missing the boat, you're taking one stem cell and then growing it into 100 million stem cells. Is that what you're saying?
Yeah, it's a process. It's duplicating. It isn't actually a clone. You're not allowed to clone a cell, but it is a multiplication of that cell when you add the growth factor. So in the US also, they're only able to get to stage 2, which stage 1 and stage 2 is very weak. The sweet point is really stage 4 to stage 6, where we stay in between. So in those stages, the cell actually gets fatter and fatter. It takes a good 8 or 9 months to get it from stage 1 to stage 4. In that period of time, the cell actually gets fatter and fatter. But what you're looking is at the integrity of the cell. So the fatter the cell, the higher the markers, the better quality. So if you're talking about cancer killers, we do have some stuff in our laboratory there. I really don't push that too much. It's more of the research and development side of us, but that is a higher caliber cell with very high markers that they're using for the cancer killers.
Now, Russ, when you're talking about the sourcing of the stem cells, right, the umbilical cords, I think one of the big myths, I mean, not like to hear about all the myths because there's tons of myths behind stem cells, is that it comes from aborted fetuses, right? This is one of the things a lot of people have a issue with stem cells. So maybe you can speak on that a little bit.
Yeah, I mean, I can't speak for what goes on around the world. I know morally and ethically, and you know me by now, anything like that being done, absolutely no hard. I can tell you that when the baby is born, we're at the hospital picking up the umbilical cord. I can actually show you the picture of the baby and the mother that we just got the umbilical cord.
Is that done regularly in other stem cell clinics around the world? Is that a normal thing? I don't know.
Yeah, as far as the procedures are here in Colombia, it's all has to be under what's called INFEMA, which is the FDA equivalent in the United States. So it all has to be done in here, by those same protocols. So it is regulated. Now, the quality, again, in third parties' laboratories, how they make it is where it becomes different. But as far as the mother donating the umbilical cord, it's pretty regulated. It's a pretty sound system. The medical system here in Colombia, I can't express it enough. It's amazing. There's so many things here that I see, and I look at the United States and I'm like, how come we don't have this in the United States, Colombia? Again, no offense to my doctors in the United States. I have conversations with them about their clinics. It's 90% financial and business, 10% medicine. When I have conversations with the doctors down here, it's 90% medicine, 10% business.
What's the payout though for what's the difference in income? I should ask, like compared from an American doctor to a Colombian doctor.
Yeah, again, it depends. Just like in the United States, if you're a general doctor or you're you're practicing a specific specialty like a heart surgeon or something like that. So it's going to range depending on what your profession is. But your average doctor here, when they get out of college with their doctorate, they actually have to work in 2 places, either a laboratory for 3 or 4 years, or they have to work for one of the state-run hospitals. and they're averagely making, in American terms, about $1,500 per month.
Wow.
So again, if you don't have it for the love of medicine,
Yeah.
you're not going to sit there for 4 years of your life making $1,500 a month
No.
just to get into the next part of school. So I think its process itself kind of weeds out the people that are just there. I want to be a doctor to make money, as opposed to I want to be a doctor to cure people, which is why I think at the end of it, you have the doctor, you have somebody that's more caring.
And so you had mentioned like the mesenchymal stem cells, right, is what we're getting out of the umbilical cords, right? And I know, but I also know that there's multiple types of stem cells: bone marrow, adipose, umbilical. What's the differences, and why do you choose to do the MSCs?
So going back to the United States, you will see a lot of people in the US that are not using a mesenchymal, they're using what's called a muse stem cell. So a muse stem cell is derived from the bone marrow. It's also derived from your fatty tissue. So in my opinion, it's very similar to PRP. So what you're basically getting is your own old ass cells, mixing them around like PRP and then re-injecting them in your cell. So again, the anti-inflammatory markers, the actual active amount is way off, and the recuperative factors are way lower than you're basically getting a cell that just created a human body. So that in itself is stronger than anything that's going to be in a 30, 40-year-old man that's using their own bone marrow. So everything you said there was more inside of what you call a muse stem cell, and that's been legal for a while in the United States. Let's go back to that human growth factor. So it is legal in the United States to use a human growth factor. So if you had a baby and you wanted to use that baby's blood to make the stem cell, you can do that because that is a first-party human growth factor. This is where you get all those crazy people saying they're using baby's blood.
Mm-hmm.
Is what they're talking about. It's rarely done because you're not using it on the child. It's not something that's generally practiced. So when you're using a human growth factor, it has to be a secondary growth factor, a secondary blood donor. This is not allowed in the United States. There's also new evidence right now, and there's places in Panama that are using placenta stem cells. Early results are pretty good. The results seem pretty good, very similar to the mesenchymal. The problem is there just isn't a lot of clinical studies yet. It's in its infancy. There hasn't been a ton of clinical studies on it. So it's something in the future to keep your eye on. But if you're really looking into stem cell and you're interested, this is where our protocols come from, and what we follow is really the research in China and Japan and South Korea. They're really leading the world. And there's a lot of places in Colombia, big companies that beat their chest and say that, that they're leading the way. It's just not true. The research that's coming out of Japan and South Korea is absolutely amazing.
I basically want to text you every single day. Like, can I train today, bro?
It's just on 10 other people's text messages. Some places, like there's a place in Mexico, another very good place too. They tell their patients 6 weeks you can't train. And I talk to my doctors and I basically say, listen, we're dealing with athletes. We're dealing with guys. I've had ACL surgery. I've torn my shoulder back in the gym 4 days later, getting on crutches and training. So to tell people you can't train, it's virtually impossible. So we'd rather give you a protocol where you kind of start. Yeah, the idea is we don't want you taking any ibuprofen. We don't want you doing any sauna, cold plunges, and it's the same thing with the workout. So if you're doing like an anti-aging, it's an IV drip, you're not really worried about the muscles or the knees or the back or discs. If you do those areas, you want to get a time to change, to heal. Yeah. When you're doing it intravenously, we want to keep your core temperature down. If your core temperature goes up too high or goes down too low, it'll actually kill off those cells. So that's the idea of kind of keeping you away from working out and keeping you from the extreme cold heat for those first couple of months. And the ibuprofen, we don't want to limit the inflammation powers because you're basically doing the opposite. Then you want it to inflame because that's where the healing process is.
Would it actually be better if I waited 2 months? I mean, I don't, like, you're being generous by saying 30 days is what I'm hearing here, right?
Yeah, I say 30 days, but again, when you go back, let's limit it. We don't need to, let's say you're doing lateral raises and you used to do 25 pounds, you hit 15 reps or to failure. For the next 30 days after that, let's cut it down to 10 pounds. Let's just do sets 20. So you're not going to failure. You're not going to lose any muscle mass now. You're going to maintain. but you're not really pushing it to the extreme. But guys like you that are athletes, from our first conversation, when the doctor asked you what's your training like, and you said minimal, and I laughed. Your minimal is most people's, you're thinking about training for a UFC fight. So your minimal now is comparing to what your maximum is. Most people never get to that level of training.
Sure.
So you just sitting there holding the pads and moving around and getting kicked to the body, you're still getting the shot. You're still getting the cardio, and your core temperature is still going up. You holding the pads for 3 hours is the equivalent to a normal guy working out for an entire week. So
Yeah. Yeah. I wouldn't suggest anybody train the way I used to train, right? Even high level fighters, I'm like, don't do what I did. I used to train, 3, 4 times a day, 6, 8 hours a day, like it was nothing, but you can get away with a lot of things when you're young, so it's tore a lot of things up in my body. And that kind of leads me to my next question I had for you was, we all have, especially athletes, but even regular people, we all have different conditions, right? Different injuries, whether it's arthritis, degeneration. We have, obviously, I've had tons of torn ligaments and things. So, like, if I come to you for stem cells, one of the things I like about you is y'all have been very straight up and honest about it. You'd be like, look, you can use it for this, not for this. It's going to help you with this, not with this. So, like, what would be the top things that someone would come to you for, and you'd be like, you need stem cells for this. It's going to help you. And what things would you say maybe like other companies might overpromise what stem cells can do?
yeah, of course. So let's take the knee for the first example. If it's a cartilage injury, first of all, if you get, I had a meniscus tear and they shaved it down. They don't tell you this at the time. First time they shave it down, you now have a 600% chance in 20 or 30 years of eat. If everything had on shaved down, everything starts carrying down. You get an ACL surgery, your walk is different. Now your feet collapse and goes to your hip, goes to your back problem. So all these things you're getting now that you're talking about, I had them all in my 20s, mid 30s too. 5 knee surgeries on one knee, 3 on the other knee, herniated disc. I mean, if I could go back in time, all those times training where I wanted to be a warrior and tap, I would tap every single time now if somebody put me in a guillotine. At the time I thought I was being ballsy, but at 50 years old, I'll remember now every single time I didn't do that. Going back to your knee, you have a cartilage issue. So if there's cartilage left, in that case, the stem cell is great because it'll help rebuild the cartilage. If you're bone on bone, nothing can be done with the stem cell. There's no cartilage to help. So I'd see a lot of people getting ripped off with that. They'll come to me with their MRIs and they've checked other places, and the other places are trying to sell stem cell. And I'll tell them, you have to go for a knee replacement. It's not going to help you now. You're bone on bone. I'm looking at myself right now, hair loss. If stem cell and exosomes work for hair loss, I wouldn't be sitting here bald right now. So I get guys calling me all the time, asking me about hair loss treatments. And I tell them it's just maybe when you first start getting thin, but even at that point, it needs to be something that you have to now do regularly. As soon as you stop doing it, you're going to get the hair loss again. So I've seen no effects. I work with doctors down here that do, and they tell me there's no results in this. But we are all deteriorating. We are all getting older. Everything is deteriorating. So the honest truth, and this is what I tell people, if you have the means, there is no reason why you shouldn't be getting stem cell every year and a half after your first treatment. Because no matter what, we are all deteriorating. And when it comes to an injury, and that's what I talk to, somebody come to me, they're 35, 40 years old. Listen, you're not going to slam dunk the ball again. Okay. Those days are old. But right now, your hip or your knee is deteriorating by 2 or 3% every single year. It's getting worse. It's not going to get better. So if I can get you 20% better and we stop the deterioration process, is that a win? So let's start with those goals first. If you're 50, 60% better, that's fantastic. But as long as you get a little better and we stop the deterioration, that's a win. So some people have success with this, and I don't like to overpromise, but once I say it to them like this, they're like, you're right. I don't want it to get any worse. We want to prevent, if possible, surgery to happen.
So Rustin, would you say so if you're doing like like you're talking about like regular stem cell injections, like a couple times a year or yearly, is that slow down like biological aging?
Oh, absolutely. And all the research shows it. And then with the addition of the exosomes, and we can talk about exosomes for a minute here, the exosomes really break down the inflammation inside of your body. It does a lot of other things, great recuperative factors to it, but inflammation is what ages us. The more inflamed your body gets, it's why some days you wake up and you like every joint is hurting and everything hurts at the same time. It's because your inflammation levels are high right now. Uh, so reducing that inflammation level automatically slows down the aging process. And our inflammation really comes from two sources. Your gum health, very important. You got periodontal disease, or the dentist on a regular basis, and extremely important, your gut health. Leaky gut, parasites in your gut, bacteria inside of your gut. All this stuff leads to inflammation inside of your body. And that's where the aging process. So even if we go back to my mold toxicity, that's all inflammation in your body. If I showed you a picture of me before the mold toxicity and after, I aged 10 years in about a year and a half. And this, everybody I talk to, I work with a lot of people with mold toxicity now. It is very misdiagnosed, especially in the United States. I can tell you some horror stories, psychological issues, people getting parts of their intestines taken out because it's misdiagnosed, opposed to it being mold toxicity. Lung issues, there's black mold inside of the lungs, but it ages you, it ages your body very quick because your respiration goes through the roof. That's why your mental clarity goes. It's also why you're exhausted all the time because as you're fighting that basic virus that's inside of your body, you can't sleep. So you don't go and see cloud when you have that. And that also increase the inflammation inside of your body. So that's the long answer. The short answer is keeping the inflammation low inside of your body. This is why things like cold plunges are so important. Keeping the inflammation low inside the body. The combination of sauna, all this stuff is fantastic. And if you do this with the right peptides, with the right protocol, with stem cell and exosomes, absolutely, it's going to reach. If anything, I think I'd put 3 or 4 years back on my life from what I lost at the multi-toxicity.
Let's say someone who is, young, maybe they're 20 years old, right? And they want to come get stem cells. But then let's say someone's 80 years old, right? Like, what are you going to look for in that? Like, what's the difference between the different ages? What kind of conditions are you going to be looking to diagnose on these people to help them the best that you can?
Yeah, so I look at it with people that are younger. First of all, the sicker you are, the more injury you are, the more you're going to see the results, right? If you're already healthy and you're injury free, there's nothing really, that you're going to be like, wow, this is fantastic. And so one of the things that I heard you and I heard Joe Rogan speak about this also, take the guys that are in the UFC that are in your top 10. They all have something in common. Your top NFL players all have something in common. Your bone density is much higher than most people. Your tendons and your ligaments off the charts, thicker and stronger than most people that are there. And I think that's why people make it into the top 10. It isn't necessarily your skill level fitness if your genetics aren't there and you're snapping and breaking stuff. So I can tell you that when we treat people, and myself personally, my bad shoulder became my good shoulder. And I've heard this from a lot of bodybuilders where we treated one of their shoulders, one of their health. They're like, I want to do it on the other side now because my bad side's actually stronger than my good side right now. So when I'm looking like, especially like younger athletes, why wait till you get injured? Why not now start going through that? If you're an MMA fighter or your training camp, get something done. If you're a football player in the off season, basketball in the off season, there should be no reason why it is, especially if you're a multi-million-dollar athlete, and you look at guys, you can, and it's right in front of you. Somebody like Tom Brady, what makes him play until he's, 104 years old? I have no idea, except that you aren't allowed to hit him, but still the wear and tear on his body, the practices that he went through, and it's all about taking care of your body. So I think this should be part of that process, especially if you're a young athlete.
That's a good, yeah, that's a good question to bring up into that is like, you're testing for like through the blood. So you're saying basically when you turn 35, like, hey, the way that you're going to start testing is you're going to start doing your blood work, right? But when you start treating people, for example, like if we're doing like prevent defense, right? Am I going in there and for an IV, like stem cell IV, is it just going into my system? And then the stem cells are finding the areas, are they going to the areas that need healed or there might be inflammation? Like, how do they know to do their job or where to go?
Yeah, that's right. So that's one of the reasons for the exosomes. The exosomes I explained kind of reduces the inflammation, but it also clears the path for the stem cells. So stem cells want to go and they want to attach to something. So they're usually going to attach to cells that are deteriorating, but it does go throughout your whole body. So just because we're injecting your knee doesn't mean it doesn't go throughout your leg and throughout the rest of the body. We're just kind of essentially locating. IV is just really going to be more for your inside too. It's just going to affect those areas better. Now, in the activation process, we know you have a heart condition or a lung condition. There is tweaks that we can do to the exosomes and the stem cell for those specific conditions. There's multiple types of exosomes, and there's different things we can do in the activation process. So, depending on
Can you touch on that real quick? The difference between exosomes and stem cells, and like what exactly are exosomes?
So let's talk about exosomes. That's an excellent question. I'm seeing now exosomes all over the place.
Yeah.
This.
Yeah.
So an exosome is derived from a cell. So basically, I can take a potato and get a cell from a potato. There's cells in everything that's living. I can get a piece of grass. I can derive a cell from that and create an exosome from a piece of grass. Doesn't mean it has the same healing capabilities as a cell that's coming from umbilical cord. That already has our DNA structure in it. So I'll see people there saying, "Oh, I had 500 billion exosomes." It's from a potato. You know,
They actually do that?
oh, absolutely. That's why you see all this stuff all over the place now. Exosomes are amazing, and the research is going very far right now. First of all, it is a cheaper alternative to the stem cells. So in the next 10 years, I think you're going to see some amazing results with stem cells. Obviously, the exosomes, but you're going to want to know that they actually were derived from an actual mesenchymal cell. That's your highest quality that you're going to get. The other stuff is kind of BS, but the thing with the exome, they're much easier to produce. They're much less fragile, so it's much cheaper, and it can be done at a greater pace, kind of like a peptide. So I think in the next 10 years, you're really going to see some advances in exosomes, and there's always going to be people that are trying to sell you crap. I had somebody send me something the other day that, oh, I can get stem cells sent to me through the mail, and it's a powder. And I didn't want to shit on it too bad, but I kind of explained to them, I don't know that there's a process that can take a living cell, turn it into a powder, and then you add water and it turns it back into a living cell again. Other than God, I'm pretty sure that that can't be done. But people are buying into this because it has stem cell.
If you bring someone in and you're going to be brutally honest with them, where are you going to say, this is where the evidence is the strongest, this is where the evidence is the weakest, and what's like a fair expectation for them to get out of the stem cells? Like more pain reduction, like actual structural healing, improvement in daily life. What can they come? Because I know you're a brutally honest person, and that's one of the things I like about you. And you're not going to try to overpromise and underdeliver.
Yeah, I mean, without this sounding like I'm over promising, I mean, I've had nobody that we treat now that hasn't called me back and told me, how great the results are. The exosomes right off the bat, the first 3 months, people's mental clarity, the inflammation goes down. But once you start getting in that third month to the 8th month, the hardest thing is to tell them you're not fully healed. They feel fantastic at that. And again, it depends on how debilitating your ailments are, your condition is. The sicker you are, the more you're going to feel the benefits from it, as opposed to a very healthy person. But I can tell you, and I'll give you a story here just based on what you said. I had this woman come to me, and she'd gone to 2 other stem cell places. She had an autoimmune deficiency and she spent over $60,000, and she said she felt no different. And I know just from hearing that, it must not have been done correctly, because it's virtually impossible not for you to feel a difference. So I looked at the 2 places that she went to, and I said, well, where are the lab reports? She didn't have lab reports. I asked her questions. She needed to know these questions existed. I called up these 2 places, act like I was a patient. They sent me some BS through the mail and through email and stuff, and then tried selling me this crap. And I knew that in both cases, it was something very substandard in general, not even close to what we had. So I said to this woman, I said, I don't believe in what you had before. I know you've already spent this money. I'm going to treat you. I'm going to have you pay just my cost. And at the end of it, she would have owed me $15,000. I said, if you don't feel better, you don't owe me the rest of the money. 3 months go by. I get a text alert that $15,000 was transferred to my bank account. And I called her on the phone and she said, I guess you got the money. She said, Russ, I'm walking down the beach in Mexico right now. I haven't been able to walk down the beach in 15 years. She said, I'm paying you. That feels fantastic. The fact is, if you're going to get that stepped on Yeho or you're going to get that Tony Montana shit, you got that shit here. There is a difference in what.
Yeah, that holistic approach really was interesting to me. I really enjoyed that, and I've noticed a difference myself. So, and could be, a lot of things, right? Like, I mean, I'm just healthier now, just being down there and hanging with you guys and talking to the doctors.
My doctor actually ordered a blood stream from him, and this amazed me. And he's looking at it and he says, are you getting stuffed up noses and runny noses for no reason? I'm like, yeah, I thought it was allergies. No, your histamine levels are off. Let's prescribe you this supplement. I was like, this guy knew my symptom without me telling him what my symptom was.
Yeah.
I mean,
I say that.
Stuff like that is absolutely amazing. We do that for our patients. This is why we get so many referrals and people coming to us now is because of that individualized stuff.
Stem cells are so misunderstood. And I mean, I didn't understand them when I first got stem cells. I was just like, I'll do anything to feel better. You see what I mean? I don't give a shit. Like, if it works, it works. If it doesn't, then nothing lost, right? But anyway, so let's get some of the boring shit. Side effects. I know everybody's going to be worried about that. Everybody thinks there's going to be major side effects, but are there side effects people have to worry about? And the first thing, I remember one of the first conversations I had with you was about cancer. And that really threw me off because I've gotten stem cells a bunch of times before. Nobody ever mentioned cancer to me. So maybe touch on that a little bit. But yeah, side effects and cancer.
Yeah, the side effects are minimal. I haven't experienced any clients that have had side effects for it before. You're actually putting something pretty natural in your body. It's a cell, clean cell. You have cells inside of your body. Worst I've ever seen on reports before is like a flu-like symptom, maybe a little bit feverish after getting it and stuff. But very rarely, I've never personally seen it before. I've been diving in a lot, partially because our mutual friend Mark Coleman, but he had some great results with his cognitive abilities. He's been studied by the Mayo Clinic since the stem cells they've gone up. I've been working with people that are straight patients and dementia patients. So when you do the clinical studies, they put the parameters of side effects in it. So basically what it comes out to is the treatment with stem cells has no more adverse effect than any of the current treatments that are currently out, which means that there's no side effects any more severe or any different than any other treatments out for any one of those conditions.
I thought it was cool. You guys helped his lungs too. He had the smoke inhalation. Like I never would have even thought the stem cells would be a thing for that.
Yeah, that a lot was the exosomes. That's why we had him do
Exosomes.
the exosomes, and those were special sweet exosomes just for his lungs. Now I get more referrals from him, and he's coming back down. So great. When you talk about cancer, yes, one of the reasons why we do all these blood tests at the beginning is that there's markers or indicators that you might have cancer. We can't give you the stem cell. There are cancer killers, but those are specific to tumors. If you have cancer inside your body and we give you stem cell, it can make the cancer grow much quicker. Some horrible results for it. So when I see these other places, I've literally talked to doctors about this and they say, well, if the patient looks healthy, we don't really test them for that. I'm like, well, everybody looks healthy in stage 1 and 2. It's when they get to 3 and 4, they start feeling sick. So why would you not want to check the markers in your blood? There's plenty of indicators. And if one of those are off, we've had patients come down, not a diagnosis clinic. But when we do their blood work and something's off, we say, hey, before you do the stem cell, you need to go see a specialist for this, that, or the other. So, that when it comes to things like that, and there's other issues too, that's why we do the comprehensive blood test.
Fascinating, bro. All right. So now let's say someone is interested in stem cells, and they, they listen to this podcast and they're interested, man. And I'm convinced now, right? We should get some stem cells. They're probably going to call a bunch of other clinics too, right? And they're going to call yours. They're going to shop around. What do you think someone should be asking all these clinics?
Yeah, so there are some good clinics out there. I mean, there's no doubt that people are making good quality stem cell, and there's good ones. Great place in Mexico, great place here in Colombia also. Um, I recommend you call both of them too. I think our little niche is that we're a little bit smaller, a little more personalized, but those places and my place have the safety you come. We have when we produce our own stem cell. So your barrier to entry into being a stem cell clinic, if you're buying it in me, all you need is after order and somebody. And there's a very small barrier to entry, and that's where you have all these quacks trying to jump in on the new stem cell craze. If you've taken the time to build a laboratory, to build the infrastructure that's needed to build the stem cell, let me give you an example. When I get a biotechnician and that person has to learn just the 3-day activation process takes them 8 to 9 months just to learn that process alone. That's not even creating the stem cell and the months and months of process it takes to doing it. So if you're talking to a facility and they don't have their own laboratory and they're not producing their own stem cells, run.
Or let me ask you this. Can you ask them like, hey, where do you get your stem cells from?
Oh, absolutely. You should ask them. You derive them yourself. And then you want to ask them too, can you send me copies of third-party verifications on your stem cell? I can do it in 5 minutes. I can send you third-party verifications on our cell, what the quality is, what the phase is, what the marker levels are, and what the activation levels are. I can do that. You text me, I text it to you in a couple of minutes, and they'll all be new within the past 30 days. If you contact the place and you get a sales rep and they can't send that to you, again, run.
Yeah. So on that note, what's the difference between like going to Colombia? Like, what if I call someone here in America and I say, and they have third party results or whatever, and they have some of these answers?
They have third-party results and they're producing in the United States. They're not using a human growth factor. So you're only getting phase 2 and your marker levels are never going to be there. If they say, oh no, we're getting it shipped in from another country, besides that being illegal and not being certified, you have no idea where it's coming from. In order for them to ship it, they have to freeze it and they have to use chemicals to freeze it. So think about this. If I activate something and it's alive and I freeze it, what do you think happens to the activation?
Probably not so good.
Okay. So it's just, there is nothing in the United States and I see
So
that
that's illegal to do in the United States.
it's not that it's illegal. You can't advertise it in these clays, but it's not regulated. So there is no regulation of the quality that you're getting. And here's something I hear all the time. Everybody, especially when you deal with people that are more successful, they all think they know somebody that knows.
Mm-hmm.
Oh, I got a guy and he's able to do this. That's the first thing that's bullshit. It's kind of like when your friend says to you, I met this girl, but you don't understand she's different. You already know this fuck.
Yeah.
When a guy says, well, I have a doctor that gets this and nobody knows about it, or I have a new type of stem cell that nobody knows about, there is no new type of stem cell. No, it would be all over the news. There would be clinical studies, that journals. Joe Rogan would be talking about it. It'd be all over the internet. So there's no way the one doctor in Wyoming in a small town that gets a special stem cell that nobody knows about anymore. Run if
How long have stem cells been around? How long has this been going on?
I know my first experience with stem cell was Peyton Manning, right? Where he took off for a year or two. He had a bad neck injury, came back and won the Super Bowl. That was my first time that I really, heard about it and was like, wow, that's interesting. Then years went by and I heard, like everybody else, Joe Rogan talking about it. So when I was in Colombia, I was like, my neck is messed up. Let me look into it. That's what kind of just led me down this path. So it's in some way Joe Rogan and Peyton Manning are responsible for me,
Very cool.
now living in Colombia and, going through it. Building a business down here is not easy.
So talking about American stem cells, it's not regulated. Like I've always been under the assumption that you cannot get like stem unless they're your own stem cells. Like what you were talking about earlier, going down to the bone marrow, like. So when you're going in there, they're not like umbilical stem cells from like what you're getting.
let's be clear on that. Mu stem cells are legal in the United States. It is regulated, and that's where it's coming from. Your own bone marrow fat that is regulated.
Mhm.
You can get, there are laboratories creating stem cell from a mesenchymal stem cell. Some places in Florida, that's legal, but you still cannot use a human growth factor. So you're using chemicals and you're using artificial ways of producing that stem cell. So it'll never go to the quantity that we have or have the quality that we have. And it's made with chemicals.
Any idea why? Any idea why that is?
Yeah.
So
Yeah.
I find on FDA or whatever.
I would say that that's where it is. So what you have basically, in order for you to take any product right now, if you say stem cell heals your shoulder, that's one clinical study. You got to pay hundreds of thousands of dollars to get that approved. If you say it helps your heart, it's a second one. You can't say this one thing does all this. And nobody owns the licensing rights to stem cells. So who's going to pay the money to have this all approved by the FDA if they don't have the rights to do it? So you're talking hundreds, billions, it's billions of dollars of clinical studies on individual issues, hundreds of individual issues in order to get it approved by the FDA. So without approval by the FDA, there's no standard in making the stem cell. There's no regulations on how it's made. So you don't know what you're getting.
Yeah, yeah. So someone calls you up and they say, "I want to do stem cells." What's the first thing you tell them? You say, "Hey, look, I'm considering it. I'm thinking about this. I got this issue. Like I'm older. Whatever the issue is. What's the first thing you're gonna tell them?"
Normally, I mean, I send them our brochure. We have a conversation, kind of like you and I did. Conversation over everything. There's things I hear in those conversations that I have a pretty big staff, like you see, but I handle pretty much all of our patients one-on-one. We're seeing an average of 3 to 5 per week. I don't ever see us growing past that because I think past that, I can't deal with every patient individually, and I don't want to be a manager of people. I'd rather deal directly with the patient.
You don't want to deal with more people than that either, I'm sure.
54 years old. I've had big companies with a lot of employees. I have no desire to go down that way again. I get more desire just speaking with patients. But there's a lot that you'll hear in that conversation, little issues that may not even have anything to do with the stem cell that we need to look at, and from there, I'll ask them if they have any recent blood tests, any recent MRIs. We might need to order new ones, but if they have past ones, it's great because we're able to see how things have progressed over a certain time period. And then we take it from there. We kind of go and do an assessment and say, okay, this is what we found. I'll get a list of their supplements and medications that they're taking. And then we're able to really put a proposal together for a treatment plan at that point.
Man,
So
sold, bro.
speaking of sold, like what would be like an average cost for like stem cell? I mean, and I know that there's different levels, I guess, depending on what you're going to do. But what can somebody expect to pay?
You're just anywhere on average between 18,000 and 24,000. I do things for like military, with discounts. And sometimes we get people that are really sick that can't afford it. So I help them out. And then it depends on how much you're going to need. First of all, that's another thing that, we mentioned before. Some of these places that are trying to sell you 200 million at the same time, not good. 100 million at the same time. All the results show that 200 million in your system at one time kind of burns itself off. There's a lot of new research with that. What they're trying to do is they're worried that you won't come back for your second treatments. So they want to kind of get it all and get that sales pitch in right there. The price barrier is an issue. We do have some financing available depending on the people there. It's a non-interest program that we're working on now. And to be honest with you, I've worked with people before and I've had nothing but honest people. I think when people see the results, they want to be able to come back again. So the ones that I have helped out have, either sent me people or come back themselves before. But on average, from us, you're looking about 18 to 24,000. The marketplace itself for the same quality, the same type of treatments from some of the bigger places are closer to 24 to all the way up to $40,000. Some places start at $50,000, but the place that I know that starts at 50,000, I understand it. They're very boutique also. The whole owner is hands-on too. They're not doing it like a assembly line, like a McDonald's. So for their time and the type of treatment that they do, they only look for that type of clientele that have the money to afford that, but it's a very personalized treatment we have also.
I'm sure you've seen some fucking amazing recoveries. I mean, your own story is one. right, from your mold toxicity and getting back. I was down there with you. I seen you fucking ripped up and lifting weights, looking good, showing off to the Colombian girls. But I'm sure you've seen so many ones. So I don't know, maybe give us some inspiring stories. You gave us one already. I want to hear some more, man. Let's inspire some people here.
I told you about my good friend who's a doctor with the heart issue. I mean, that blew my mind getting that. Text message actually came over and he said, I just got back from my cardiologist. And here's the good news. And he kind of laid it down. I was just absolutely blown away. But you with this one the other day, we were doing the testimonials for you and Mark Holman. It's something I knew nothing about. Mark Holman, I hate to tell his story, but I'm sure you won't mind. Um, he's been studied by the Mayo Clinic for the past 5 years. And from what I gathered from him, the first 3 years of them studying his brain, he had cognitive issues and rapid decline in his cognitive abilities. 2 years ago, he started coming to me from stem cell, and his last 2-year reports now from the Mayo Clinic show not only has his cognitive ability stopped decreasing, it's actually increasing now. So I sat there at the same time when we asked him on a testimonial video, what's the most amazing changes? Said, all my aches and pains, my shoulders feel good, my knees still good, which is great to hear that. But when you hear about somebody's cognitive ability, it amazed me. I actually sent Matt a text message before. It's peptides that are out that are proven now to work with cognitive ability. So I happen to have 2 stroke patients that are new to us. That's not something I normally deal with, but referrals from other doctors that are friends of mine. And amazing results with the stem cell on cognitive abilities. There's monetary, which is fantastic, but getting these type of texts, I actually said it earlier, and I said, let me never lose sight that these results that we're getting supersede the monetary side of this business.
Nice.
That this is what I want to be focused on. This is I've had many businesses throughout my life that were successful, but when I look back at the things that I'm the most grateful for is my animal rescue. All the dogs that I saved, I found homes for, the cars and stuff like that. You never really think about. So on this side of it, those stories that I told you, this one about Mark, it really makes it all worthwhile. Things like that.
That's the thing too, is these people like, and that's everybody, men, women, a lot of people look for the magic pill. They just want the magic pill. Like we're talking about stem cells, but like stem cells, it's not just the magic pill. There's a whole protocol that goes with it that you're talking about. I mean, it's a lifestyle. Like if you're going to spend $24,000 or $50,000 on stem cells, well, there's a lifestyle. You've got to you've got to impose this lifestyle on yourself with this, exercise, healthy eating. You've got to back off. You've got to start looking into yourself. It's not just a magic pill. And a lot of people just want that magic pill. I want to take the pill. I want to lose the weight. And that's all I want to do. They don't want to get off the couch. They don't want to work. They don't want the magic pill.
But Russ, thank you for coming on. We want to bring you on a lot more. I think we could get way deeper into all this. We just kind of tried to brush over everything today. I want to ask you some of those basic questions and kind of go from there. But I think we can get you back on and dig deeper into some of these rabbit holes.
It's awesome. It's awesome.
Appreciate it. Love to talk more about individual cases also. And now that we're conducting case studies right now, and we're including in the peptides and doing testosterone treatments into it also. So we're in the early stages now, but luckily we have a lot of guys at the same age group that are athletes or health enthusiasts, so that we have a really good core of what's coming down here now. Most everybody is using peptides already or using testosterone. So we're really starting to collect the data right now, seeing how all these things kind of work together. I think that's going to be the future.
Again, thank you for coming on, Russ, and we'll have you on another time, hopefully sooner rather than later.
Thanks, Rustin. Awesome, man. Awesome.
I will text you later, man. I appreciate it, guys. Have a good day.
Thank you so much, my man.